hear. I should be able to hear. I should be able to hear.
Hello.
Hi, this
webinar has not started yet.
It
Just one
hasn't
moment,
started
please.
yet. Can you hear me good? This is Tina Fleeting from Bananas.
Yes, thank you, Tina. Could you please place yourself on mute? We'll start in just one moment.
Okay, sure. Thank you.
Carrie, would you like to go ahead and start?
Absolutely. Good afternoon, everyone. From snowy Chicago, this is Carrie Byers, and I'm Assistant Director of Illinois Policy at the Ounce of Prevention Fund and Chairperson of the NACI Early Childhood Committee. On behalf of the committee, thank you for tuning in for today's webinar, Early Head Start, Supporting Students Experiencing Homelessness. In a moment, I will introduce our presenter for today, but first, a few housekeeping items. Today's webinar is being recorded and will be available on the NACI website for on-demand viewing along with the PowerPoint slide deck for the presentation. You will receive an email with a link to access the recording and materials when they are ready. Please mute your line throughout the webinar. We are happy to take your questions as time allows if you type them into the chat box. If we are unable to get to questions, we will develop a Q&A document addressing your questions and post it along with the webinar recording and slide deck. It is now my pleasure to introduce today's presenter, NACI Early Childhood Committee member, Tracy Duarte. Tracy has worked in the field of early childhood education and Head Start, Early Head Start for over 20 years. She currently works for the PA Key, where she has served as the director of the Pennsylvania Head Start State Collaboration Office for the past 6 years. In this role, she serves as the liaison between Pennsylvania state programs and initiatives that serve families and children ages birth to 5 and Head Start and Early Head Start programs. Prior to her role with the Pennsylvania Head Start State Collaboration Office, Tracy was the director of the Venango County Early Head Start program for 12 years. She also served as the infant toddler specialist for Pennsylvania through 0 to 3 and was a consultant providing training and technical assistance to programs also through 0 to 3. Tracy lives in Oil City, Pennsylvania. Thank you again for being with us today, Tracy. Take it away.
Tracy, can you go ahead and hear?
Yes, I can hear now. I'm experiencing my messages telling me that there are connection issues and I was losing Carrie for a minute. So okay. If the organizers can just chat me in the chat box and let me know, please, if you are unable to hear me for some reason, or if you lose
Certainly.
me. Thank you.
Thank you.
Okay, there always has to be a little bit of a technical difficulty, right? Or it wouldn't be a good webinar. So good afternoon, everyone. This is Tracy Duarte. Thank you, Carrie, for that wonderful introduction. I'm really thrilled and honored to have been given this opportunity this afternoon to be with you and to talk to the group about Early Head Start and the efforts of Early Head Start programs across the country to help support infants and toddlers experiencing homelessness. So thank you again for joining us this afternoon. We'll just get started here. My slide. There we go. So for this afternoon, we have two main objectives, as you can see on your screen. First, I really want to provide you with a very basic overview of federal Early Head Start programs, to include the goals of the program, services that are offered, eligibility requirements, and all of the benefits for families and children. Then I really hope to demonstrate to all of you why it is that I really feel that Early Head Start and Head Start both are an excellent fit for families that are experiencing homelessness, and how McKinney-Vento liaison specifically, but really any other stakeholders working locally in communities where Early Head Start services are available and Head Start can find them, partner with them, build relationships with them, and collaborate really to improve the services that are offered to those children and families. So those of us in the Head Start and Early Head Start community really do believe that Head Start and Early Head Start are a perfect match for families that are experiencing homelessness. And there's a number of reasons why we feel that way. I have to say the first one is, and this is something that you're going to continue to hear throughout this webinar from me today, is that Head Start has comprehensive services, and Early Head Start provides comprehensive services not just to the children, but also to the families that they serve, as well as really to their local communities in which they operate. Early Head Start provides health, oral health, mental health, and nutrition, education, services, and tracking to children. It's really a two-generational program where they are certainly working to improve the child development, health, and well-being of the children that they serve, but also extending that to the families. Early Head Start staff are really experts at developing and maintaining relationships within their communities so that they can link families and children to services such as those listed here. I listed some here that are really specific to families that you may be serving or working with that are experiencing homelessness, such as housing, mental health, education, and of course, food and clothing banks. So just a few basics here about really the difference between Head Start and Early Head Start. So Head Start, both of them are federally funded programs. They're one of the few that, or maybe the only one that I'm aware of in the early childhood field that are funded directly from the federal government to local grantees. So the money typically does not pass through the state. It goes directly to those local, what we call grantees. So the grantee for a Head Start or an Early Head Start program is the entity that receives the funding and then delivers the services. It can be a community action agency, it can be a school district, it can be a county government, and that agency we refer to in our world of Head Start and Early Head Start as the grantee. There are some occasions where that grantee, especially in larger urban areas, might delegate some of those services. So if a county government is a grantee, they might possibly delegate the operation of the program to a local community action agency. It can be rather confusing sometimes to navigate the world of how Head Start and Early Head Start operate. I'm going to talk about that a little bit later in the presentation. But just to kind of give you a little bit of a sense of how they are funded and how sometimes that funding is then passed down to other entities within a community. Head Start began in 1965 as a part of the War on Poverty and is a program that has survived over all of these years. Really, it's rather unusual for a federally funded program to last as long as Head Start has lasted. The two main primary goals of Head Start are certainly to break the cycle of poverty. It is an anti-poverty program, and to improve school readiness for young children. And Head Start serves ages 3 to 5 and primarily in center-based options. We'll talk a little bit more about the different options for Head Start and Early Head Start in a minute. So Early Head Start came later. It was created in 1995 to serve infants, toddlers, and pregnant women. It serves children ages birth to age 3, and as I just said, pregnant women. Only a small fraction of eligible children are served in the early Head Start programs across the country. I'll show you some statistics in a minute. And it's really considered a gold standard for early education programs throughout the country. So as I said, early Head Start serves infants and toddlers under 3 and pregnant women. It provides early and continuous, intensive, and again, that word comprehensive child development and family support services to low-income families and children. Really, the purpose is to nurture healthy relationships between the child and he or she's parents or caregivers, and to enhance the positive developmental outcomes of children through all of these supportive services that are provided to the child and the family and the community in which they live. The goals of Early Head Start are to promote optimal social, intellectual, emotional, and physical development of children, really to support parents in their role as caregivers, teachers, and providers. So Early Head Start programs really aim to assist in developing that relationship between the parent or the caregiver and the child to their fullest potential. And in Early Head Start, we often say it is sort of a mantra that really we try to encourage the parent to see themselves as their child's first and best teacher. So as Early Head Start staff, whether it be a center-based teacher or an assistant teacher or a home visit, going into the home and working with families, they really see themselves as being a person who can help the parent become that first and best teacher. So they kind of take a secondary role rather than being that expert. They try to encourage the parent to learn about child development and they to be the parent. Early Head Start really strives to promote and enhance existing community resources for the benefit of the children and families that they serve. So Head Start and Early Head Start workers really do become experts on their local communities and what services are in the community to help families. They really excel at building relationships with those community providers. And they're also very in tune to what is not available in their local communities. And they serve as really excellent advocates to try to bring those services to their local community or oftentimes develop them themselves. So it's always, I believe it's always beneficial as a provider working with young children to reach out to your Early Head Start and Head Start programs. And certainly they strive to provide the highest quality services throughout the development, through the development of caring and well-trained staff. And I'm sure most of you on the call today are aware of sometimes how difficult that is right now in the early childhood education field, because it's really a field where the staff are sort of underutilized, underpaid, and not necessarily considered oftentimes professionals. So unfortunately, there's sometimes a lot of turnover, and oftentimes it's difficult to find Early Head Start teachers and staff. So while it remains a challenge for Early Head Start to keep high quality caregivers on their in their classrooms and as home visitors, they are working very hard from the federal level down to the local level to make improvements to that. So as I have said a couple of times, Early Head Start does provide comprehensive program services. So what does that mean? And why is that different? And when I talk about Early Head Start and Head Start and why it is the perfect match, and I talk about comprehensive services, by no means do I mean to say that other early childhood programs available are not quality. It means that Early Head Start, fortunately, is funded to be able to provide all of these additional comprehensive services that other childcare or pre-K programs aren't necessarily funded to do. So while those of us in Head Start and Early Head Start tend to think, that we're the best and that we provide the best services, the truth is that we are funded at a level that allows us to do that. And really the goal when we're talking about children, young children, ages 0 to 5, who are experiencing homelessness, the goal is always to match them to a quality early childhood education program. And if that can be Head Start and Early Head Start, then that's terrific. But if that's not possible, we always want to try to match them to a high quality early learning environment. So what is it about Early Head Start that makes it comprehensive? The child development and activities or curriculum of the programs are just the beginning of what we call our comprehensive services. We also offer parental support and resources, connections to those community resources. We provide linkages to quality childcare if that's necessary. If there is a wait list for our Head Start or our Early Head Start services, then we link families to other quality early childhood programs. If we are a home-based program, Early Head Start program, and the family needs childcare, then the Early Head Start staff can help link them to that quality childcare. Head Start and Early Head Start programs are required to have a licensed nutritionist or dietitian, either as a staff member or a consultant, to help them provide nutritional education and, of course, healthy meals through the child adult care food program to all of the children that they serve. Head Start programs are also, and Early Head Start programs are required to track all of the health indicators of the children in their program, which means making sure that they have an identified medical home, making sure that they have a dentist and that they're getting the oral health checks and screenings that are required for their age per the EPSDT, which is the Early Periodic Diagnostic and Screening Tool. Also referring those children that are screened or have an exam, a health or dental exam, and need further referral, making sure that those families actually follow up and get the additional services for their children. Also, Early Head Start does early literacy development. And of course, we offer infant health and parent mental health supports and referrals. Early Head Start programs and Head Start programs are also required to have a mental health consultant that provides supports not only to the families, but primarily to the staff to help them increase their opportunities and abilities to support children, parents, and families who may be showing or reaching out for mental health supports. So there are a number of different program options in the Early Head Start program. The first and often most obvious option is a center-based option. It can be a full day option, a part day option, or it can be in partnership with a local child care center. So this is what people typically look at or think of as childcare setting. In different areas and different states, there may be more children served in a center-based option versus a home-based option, which is the next here on your slide. Home-based children and families that receive home-based services receive weekly home visits that last an hour and a half by a trained home visitor who they do have a curriculum that they follow and use in the context of the home with the family. And they also in a home-based option offer parent and child education groups, which are sometimes known as socializations. There is also the option of family child care homes, which is where a family or a person operates an early Head Start program out of their home. So they are, in some states, that would require them to be licensed. It would require them to follow all of the regulations that any other Head Start program has to follow or early Head Start program has to follow. And finally, grantees are given the option to design programs locally that best meet their needs. So that could mean a combination of home-based and center-based option. It can mean mixed options. Basically, they are free to develop any combination or locally designed option that they feel best suits their local community and have that approved by the Office of Head Start. So there are lots of options for early Head Start programs, which oftentimes, unfortunately, may make it a little bit more confusing for community partners to recognize those programs as being early Head Start. And we'll talk again about that in a little bit here. So eligibility for early Head Start. Children must be ages, of course, between the age of birth to 3, or also an expectant mom or expectant parents. Just a little bit of a warning, all early Head Start programs sort of have the ability to shape the services that they offer to expectant parents differently. There are very few specific regulations around how many visits, for example, they have to provide to those families and how they shape those services. So they can look very different from state to state and certainly from community to community. Head Start programs serve children ages 3 to 5. In order to be eligible, children must come from families whose income is below the federal poverty guidelines. However, there are a few exceptions. One is children that are experiencing homelessness. They are eligible automatically or categorically, as we call it, eligible for services regardless of the income of the family that they're currently living with, whether that be their family, their parents, their caregivers, or if they're living in a doubled up situation, that would not matter. They're automatically eligible. Foster children are automatically eligible regardless of income. Children whose families receive public assistance, such as TANF or SSI, are automatically eligible. Excuse me. And just as a side note, Head Start and early Head Start programs are expected to have 10% of their enrollment reserved for children with disabilities. In some areas, that's very easy to accomplish. I know here in Pennsylvania, many of our grantees serve well over between 15 and 20% of their slots, as we call them, or their children who have disabilities. And there are other, my friend Carrie here on the webinar tells me that sometimes in Chicago that programs really struggle to be able to fill 10% of their enrollment with children who have diagnosed disabilities. So that can really differ across states and certainly into local communities. One note I did make down here at the bottom of the slide, and this is something that often parents don't understand and local partners don't necessarily understand, and that is that in early Head Start and Head Start, when their slots are full, they have to have a wait list. They're required to maintain a waiting list. So when they have a wait list, they use what they call selection criteria. And so basically they have to develop a point system whereby they prioritize the children that are on their wait list by risk factor. So a child who has maybe a diagnosed disability, it could be they come from a family where there has been a parent has been incarcerated. There may be drug abuse or substance abuse activity in the home. It could be that the child is living with a single mother who's a teenager. It just kind of depends on what the needs in the local community are. But basically, this point system causes the children who are most vulnerable and most at risk to rise to the top of the wait list. Certainly, children experiencing homelessness are going to rise to the top of that wait list. So it's important to know that it is not a first come, first served program. So while a family may have had their child put on the wait list 3 months ago, 3 slots might open tomorrow and their child may not be able to get into one of those, because there may be children on that wait list who have been moved up to the top of the wait list because of the circumstances within that they're experiencing, or some of the risk factors that there is in their family. So that's an important piece for folks to sort of understand. Okay, once again, I just want to highlight some additional comprehensive services that are provided by Early Head Start and Head Start. I certainly will not read this list to you, but as you can see, we tend to, we do screenings within the program. We do tracking and referrals, as I mentioned. We, one thing that's really interesting about Head Start is this concept towards the bottom of shared governance. So parents are really encouraged to be decision makers within the programs where their children are being served. Head Start's shared governance means that the entity that is the grantee typically would have a board of directors, and that board of directors typically is the governing body for that agency. Well, when there's a Head Start program involved, that governing body has to share their decision making with what we call a policy council. And every Early Head Start and Head Start program must have a policy council. And that policy council is made up of 51% or more parents who currently have children enrolled in the program. So they're the majority of that body, that governing body, and they help to make decisions as a policy council about the hiring and firing of staff, about changes to the program model, about changes to the delivery of services. They sign off on policies and procedures. Really all of the main, most important decisions that are made that affect or impact an Early Head Start or Head Start program, those parents that make up the majority of that policy council have a true voice in those decisions. So it's really a wonderful way to empower parents who are involved with Early Head Start and Head Start programs. And since 1965, it's really been one of the shining stars that makes Early Head Start and Head Start programs stand out. Okay, so one nerdy slide here that I put in for those of us that like data. I just put a few numbers in here and I compared it because all states are different. I just kind of wanted for all of you to see how things can vary a little bit. So if you look at these national numbers, nationally, excuse me, Early Head Start serves 166,693 total children, and of them, just over 6,000 are pregnant women. In Pennsylvania, Early Head Start only serves about 6,500 children, and just over 200 of them are pregnant women. And then the discrepancy at the national level, 55% of those Early Head Start kids are served in a center-based program, 35.5% at home-based programs, and only 3.5% in a family childcare setting. Whereas in Pennsylvania, it kind of flip-flops in that the majority of Early Head Start children in Pennsylvania are served in a home-based option. I would guess, and I don't know, But Pennsylvania, while it's a very large state, it's also a very rural state because we have a few large cities like Philadelphia and Pittsburgh, but otherwise we have a vast area of rural counties and communities, and so a home-based program often is better suited for those rural areas. And then in both cases, actually, Pennsylvania is a little bit higher than the nation, and that we serve 7.93 of the children enrolled in early Head Start are enrolled due to their status at enrollment of being identified as meeting that McKinney-Vento definition as homeless. And overall, nationally, it's 7.5% of early Head Start children are enrolled due to their status as homeless. So we have a long way to go. Those are not really great statistics. And part of the reason why, we'll talk here in a second, the Office of Head Start and Dr. Bergeron started a campaign really to try to increase these numbers. Because Head Start and early Head Start are situated purposefully to be the premier comprehensive program to serve our most vulnerable children and families, then certainly we should be trying to find, locate, recruit, and enroll children and families experiencing homelessness first and foremost. And as I was saying, there is a national campaign that was begun in 2018 by Dr. Deborah Bergeron, who is currently our director at the Office of Head Start. And this campaign really challenges all of the Head Start and early Head Start programs nationally to increase the number of children that they have enrolled in their programs that are experiencing homelessness. Also, she has challenged all of us to have every single one of our staff members that work within our early Head Start and Head Start programs to go online and take those early learning modules around serving families and children experiencing homelessness. And they are found on what we call the eClick website, Early Childhood Learning and Knowledge Center. If you're out there taking notes, don't worry about doing that because I have the resources listed at the end with hyperlinks for you. And I do understand that this PowerPoint will be either posted or emailed out to all of you. So you don't have to take notes here. You'll receive it and you'll have access to all of those links at the end. And I apologize. I probably should have said that sooner. So yes, this Home at Head Start campaign has really drawn attention to the need to improve our services and early Head Start and Head Start to children experiencing homelessness across the country. And it's really, I believe, developed a sensitivity within our staff across the country in Head Start and early Head Start. So they are well positioned, I believe, throughout the country. They should be well positioned and ready and eager to hear from partners within their local communities who are eager and willing to partner and collaborate with them to really develop relationships whereby you can together refer back and forth and hold other joint activities so that you can collaborate to improve those services that together you're providing to the early Head Start and Head Start children. Okay, so we had one nerdy data slide, and now we're going to have sort of a boring regulatory slide. But I think it's important to put this in because Head Start and early Head Start are really very complex programs, and they have an extensive set of regulations. We call them Head Start performance standards that they're really bound to follow. They have to follow these performance standards. And they also have to follow what's outlined in the Head Start Act. So I've just kind of put links to them here. I'm sure you probably won't really feel a need to go to them, but should you, here you have them. Not only are Head Start and Early Head Start programs required to follow all of these sort of regulatory, all of these regulations, they're also monitored by the Federal Office of Head Start to make sure that they are in fact in compliance with all of these regulations. So if you find that Head Start and Early Head Start programs are reaching out to you because they're asking you to sit on, maybe sit on a policy council or sit on their health services advisory committee, or come take part in some activities, or maybe a planning group or committee that they're hosting, the reason why they're reaching out to you is normally twofold. One, they really do want and need your input. But the other reason why is because oftentimes they are required to do that. They are required to have community input and community stakeholder involvement in the work that they do. So if you're asked and you are able and you have the time and the willingness, I really do encourage you to please join them and agree to sit on committees or policy counselors or whatever it is that they might be asking. Okay, so let's talk about specific services or specific regulations pertaining to children and families experiencing homelessness. So the bullets on this slide talk about what Head Start and Early Head Start programs are required to do. So they are required to use the McKinney-Vento definition of homelessness. They're required to actively recruit, identify, and prioritize children that are experiencing homelessness for enrollment. We did talk about that a little bit on a prior slide. They're required to do a community needs assessment every 5 years and update it annually. And part of that community needs assessment is they are required to collect data from within their service area on the number of children and families experiencing homelessness, data regarding where those families are residing for the most part. Do they know what services are available to them? Any community-wide data that they can find that will help them paint a picture of families experiencing homelessness in their service area. They also have to take steps to coordinate with what we call their feeder schools. So whether it be the public school system or any other schools, that children who, when they turn 5 or graduate from Head Start, finish their Head Start experience, where are they going to kindergarten or first grade? Developing relationships with those feeder schools and coordinating with them so that they can develop relationships, therefore, with their McKinney-Vento liaisons and develop a strategy of coordinated services for families, and certainly provide that transition in the case of Head Start with the older children. So that's what programs are required to do. And here are a couple of things that they are permitted to do, but they don't have to. And a big one really is programs are permitted to reserve up to 10% of their total enrollment and set those slots aside for children experiencing homelessness or foster children for 30 days. So in other words, at the beginning of a school year, if there's let's just say 100 children, 3% of those, and let's just say they're all center-based. So 3% of all of the chairs can be empty on day 1. And those empty chairs will not be counted against them in terms of their enrollment numbers because they're being reserved for children who are either identified as homeless per McKinney-Vento or foster children. And those slots can maintain that vacancy for 30 days. However, the program has to be actively recruiting and identifying and attempting to enroll children who are either in foster care or experiencing homelessness to fill those vacancies within 30 days. After 30 days, that slot is no longer considered to be reserved for those children, and then they have 30 days to fill it from their wait list with any child, whether they've been identified as homeless or a foster child. Doesn't matter. They have to just fill the slot within the next 30 days. Excuse me. Now, again, programs are able to do that. They're permitted to do that, but they are not required to. And I know in Pennsylvania, the number of programs are really, from what I'm hearing, I don't have a set number, but the number of programs that are doing that is slowly increasing. I'm talking to more and more programs who are taking advantage of the opportunity to reserve that 10% of slots. Early Head Start and Head Start programs are also permitted to immediately enroll children who are identified as homeless or meeting that McKinney-Vento definition. They can enroll them immediately while they're gathering and helping families to gather the required documents for enrollment. So they don't have to wait or make a family or a child wait to receive services. They can put them in there right away and then work with the family to gather all the documents that are necessary. And if you have more, if you want more information about the specific Head Start performance standards pertaining to serving children and families experiencing homelessness, there is a document on NACY's website that summarizes really nicely all of those Head Start performance standards. Okay, Carrie just told me that I made a slide. I did make a mistake. This PowerPoint says 10% and it's 3%. So I apologize. I'll fix that before we send it out to you. Sorry about that. Thanks, Carrie.
No problem. I'm sure we just got mixed up with the disabilities percentage.
I think
No
you're
worries.
absolutely right. Okay, thanks, Carrie. Next, so if you are a provider or a McKinney-Vento liaison in your state and you don't know if there is an early Head Start program in your school district or in your county, in your excuse me, service area, or a Head Start program for that matter, on that what I call the eClick website that I have a link for you in the resources, Early Childhood Learning and Knowledge Center website, there is a Head Start locator. So all you do is put in your city, state, or zip code and search, and it should pull up for you all of the Head Start and Early Head Start locations in that area that you did a search for. Now, because sometimes Head Start and Early Head Start is a little bit tricky and very complex, as I said later, if you're struggling and you just feel like maybe the information you're getting in your search can't be accurate because you're sure there's programs out there, I always encourage you to reach out to your Head Start State Collaboration Office. There is a directory at that same eClick website. I've given, I think I have a direct link to it in the resources. Your state collaboration office director is really very, they're really experts on all of the Head Start and Early Head Start programs and grantees within your state, and they are the person that is going to be able to lead you to all of those programs in your service area. So if you don't have the luck or the ability that you feel like you should be having on this locator, please go to that directory of collab offices and reach out to your state collaboration office director. All right, so what can you do to collaborate with your local early Head Start programs? First and foremost, develop relationships. Reach out to them. I'm quite certain they'll be thrilled that you're reaching out to them. They're always eager to build relationships with community partners. And I think all of us know that it always helps if we know somebody, right? There's somebody that you can call directly, you know their name, you have a relationship with them that you can say to them, hey, Carrie, or hey, Tisha, I have a problem, or I have a need, can you help me? And even if they can't, because you have a relationship with them, they're going to find you the person that can. So reach out, get to know your Head Start and early Head Start programs in your communities and find that go-to person. Ask them, do you have vacancies right now? Are you struggling to maintain a wait list? And if so, how can I help you identify those children and families in our community that are experiencing homelessness? How can I help you fill your slots? Or how can I help you identify children experiencing homelessness? Know or learn about their waiting list, like I said, and their policies and procedures for enrollment. How do they prioritize children? Do they have children experiencing homelessness at the top? If not, if they don't, why? If can you help them maybe see that differently? And just remember that not all two early Head Start programs are alike. They're all very different based on that local flair, based on the local community and meeting their needs. Always try to establish a nice, robust system of referring children and families back and forth. So McKinney-Vento liaisons, you're serving a number of children that are in school. Finding out if there are young siblings at home is really a first step that you can do to help locate those children, those young children under 5 who are experiencing homelessness, and then refer them to your local early Head Start or Head Start program. And hopefully, if the Head Start or early Head Start program don't have openings, or they can't serve that child for some reason, they'll know other quality early childhood programs in the area that they can send them to or refer you to for them. Anytime you can do a cross systems training between your McKinney-Vento staff or your local housing or homeless provider and the early Head Start and Head Start staff, that's always a win-win. One of the things I've done across Pennsylvania is our state homeless education program. Our TNTA folks are divided into 8 regions. And I went to each region and held a roundtable where we invited, in collaboration with that regional TA sort of coordinator, we held these roundtables and invited early Head Start and Head Start programs together with McKinney-Vento liaisons, early intervention providers, and housing and homeless providers in that region together to help them learn about each other and develop relationships. We did that across 8 regions in Pennsylvania. It's really not a difficult thing to do, and it really proved to be very successful. And a lot of relationships were developed, and smaller sort of local groups were formed after many of those roundtables. So it's a suggestion that seems to, it really did have positive impacts in Pennsylvania. If you don't have a local coalition around homelessness, maybe start one, or if you do, join it and see what you can learn there and how you can assist them. And then any partnerships you can develop at the local level with your early Head Start and Head Start providers would be great. Okay, so just to wrap up, a few things to keep in mind, and that is, like I said, early Head Start and Head Start programs can be very complex. They can be difficult to navigate in some areas, especially in large urban settings. Many of our early Head Start programs across the country, because it didn't start until 1995, and Head Start programs have been around since 1965. Many of your early Head Start programs started under a grantee that already had a big Head Start program. So the name of that program might be something like Community Services Head Start, or Venango County Head Start, or Baltimore City Head Start. And even though the name is Head Start, that's often a catch-all. So it might be called Head Start, but they might very well have an early Head Start program also. It's just not necessarily well advertised. So don't ever make the assumption that there isn't an early Head Start program. Always inquire. Staffing can be very complex as well, and titles are often different from one program to another. So keep that in mind. You might have a family service coordinator that you're working with in this county, but in the next county over, when you inquire about who their family service coordinator is, there may not be such a person. They might have a different title. So just keep that in mind. Again, all of their policies and procedures can be different from one program to the next. So you can't assume because you're familiar with one program that the other is going to be the same. You always have to inquire and be curious and ask a lot of questions. And finally, again, use that state collaboration office director as much as you can. Don't let any of the confusion frustrate you. If you contact your state collaboration office, that director can most likely provide you a list within 24 hours, if not immediately, of every early Head Start and Head Start program across the state or in your service area or wherever it is that you're looking for. So always, always, always try to reach out to your collab office director. This is just a page of resources with those hyperlinks that I put together for all of you. And like I said, this will come your way via, I believe, via email, or it will be posted. So these will all be available to you. These are great resources. In fact, this morning I was going over this PowerPoint again very quickly, and I got sucked into that Sesame Street and Communities website, and I couldn't get out of it because it's kind of like Pinterest. Once you get in there, it's hard to get out because they have such beautiful, fun videos and resources. And that is all I have for you today. Carrie, do we have questions in the chat box?
Okay, I do see one question that just came in. It says, I work for our local child welfare agency. I'm a caseworker for our emergency housing program. I've had families residing in our emergency housing. Hold on, sorry about that. In our emergency housing program, where a Head Start child was enrolled in one location, but available housing was in a different location. How is Head transporting the child to their former classroom or finding a spot for the child in the Head Start classroom where they currently reside? That's a great question. So it sounds like it's what is the responsibility of Head Start when it comes to that, mobility and, children moving from program to program?
That is a really great question, and I have a really definitive answer, which is it depends. Unfortunately, it's a great question with a very tough answer. It really does depend on, first of all, who is the grantee. So if the grantee of that early Head Start or Head Start program is an LEA, so if they're a school district or a lead, an education entity, then they have to follow McKinney-Vento to the letter. And they would hold that responsibility like a school district would. But if they're a community provider that is not an LEA, then the responsibility is not as great. And often Head Start programs don't provide transportation at all. Some do, and some don't. So really the answer is going to depend on who the program is, who their grantee is, and what their policies and procedures are, and their availability to provide transportation. Now, some may provide transportation, but they may have a particular area that they transport within and won't go out of it. Some programs will assist families with public transportation if it's in an urban area. Again, I'm sorry, I don't have a definite answer for you. That's something that you really have to talk to that particular program about and see if there's something that you can do together to work together to, improve their ability to serve those children that are living in, in a different area away from that program. And I hope that made sense. Carrie,
Yes.
did you have anything you want to add?
Yeah, I mean, the only thing I'll add is that I do believe that programs are certainly permitted to keep children enrolled if they move. But again, the transportation is transportation that Tracy just described, that is true. It's not really required unless the Head Start program is administered by an LEA. So I do see maybe one or two questions and comments. And unfortunately, I think we are out of time. We only have a couple minutes left, and I know that we will be kind of cut off right at time. So I think what we can commit to doing is for those questions that I see in the chat box, we'll make sure that we write up responses to you and get those out when we send materials. I want to thank everyone for joining the webinar today. I know we were really excited to have such a positive response to this particular topic and hope to be back soon with another webinar on similar content. As I mentioned earlier, the recording and slide deck will be posted and we'll email that to you. In the meantime, if you have any questions about early Head Start, or any other early care and education topic, please don't hesitate to reach out to Tracy or to me at any time. Tracy, thank you so much for sharing all of your extensive knowledge with us. And thanks everyone, and just have a great day.
Thank you very much, everyone. Have a great day.